time in your professional career that you brought feminism to bear on your work as a psychologist in a direct way? Or?
Well, it was less direct, but earlier in the 70s, I had been interested in ethical issues. And at the time, APA didn't have an ethical standard that says a therapist shouldn't have sex with a client or patient. And I was troubled by this. I remember going to one session at APA, sponsored by Division 29 in the division rooms, where they were having a debate, two sides of notable psychologists. I remember one was Albert Ellis.
Albert Ellis.
Yeah, and there was one of these guys from California. I can't remember. But anyway, some notable Division 29 psychologists. And they were having a debate of, is it beneficial or not beneficial to have sex with your patients? Right out there. Right there, So I wrote this article based on the then ethical principles, called Ethical Considerations in the Use of Sexual Contact in Therapy. And I sent it to the American Psychologist. And it was returned with only one review, which said, this article treats this subject too lightly. So I wrote to the editor and I said, well, could I have a second review? So, and he rejected them on that basis. So he sent out the second review for another review, and this came back essentially saying, this article treats this subject too seriously. And so here you have these opposite reviews, and he still rejects it, So I got it published in Psychotherapy. And that was one of the first ethical articles, dealing with the then existing criteria about having sex with clients. And there are certainly mundane kind of things that occurred to me, like, what training and supervision have you had in this modality that, qualifies you to give sex to your patients?
Well, tell me about, I know, because I know there was more follow-up to this story. Can you tell me about how that all evolved? Because there was work done to change then.
Some of the other women in APA were working to change the ethical principles in this way. One who really worked very hard was Hannah Lerman. And I, as a woman had gotten organized, and this is leaping ahead a little bit, in APA, I had been nominated to be on the board of professional affairs, but they didn't want me. So they shuffled me into the ethics committee thinking I would do less harm there. Surprise! So we made a lot of changes, and eventually they did, I guess it was, I forget which year it was, they made sex with a patient unethical. But there were also procedures in ethics that we